Hey, everybody. Emergency episode. Michael Madsen's recent death. Great classic movie, Reservoir Dogs. We just had to discuss. Check it out. Hey, everybody. Welcome to Gross Anatomy, where we explain. Hey, everybody. Welcome to Gross Anatomy, where we discuss the sights, smells, and sounds of medicine, how it relates to movies, TV, books, pop culture, podcasts, and the world around us. And I am Dr. Jason Cohen.
I'm Lauren Taylor.
And today we're talking about celebrity deaths, right? Pretty much we're talking about all those famous people that have died of untimely deaths, correct? Yeah.
Yes, untimely.
And that have crossed my paths. And there was a recent one, and that's what kind of made me want to do this episode.
I don't want to get you in trouble, so I guess you can't say their names, obviously.
I don't think I could say their names. I'm not sure if I'm allowed to say their names. I could probably talk about adjacent things, but not necessarily that. But you're wearing a special shirt today, Lauren Taylor, aren't you?
So
you're wearing...
Yeah. We're talking about sad deaths, but I'm wearing a Champions shirt because Oklahoma City Thunder won the championship, so they're champions.
What sport?
Basketball.
Yeah, that's the one thing that although we do talk sports, but that's not kind of my wheelhouse is sports, although I guess it's yours a little bit.
Sports is, I mean, I just watch basketball, but like there's a lot of crazy injuries that I always want to ask you about, so maybe we'll talk sports in the future.
Yeah, or we could have Dr. Clapper back on the show. Haven't we had Clapper? Yeah, we could get, in fact, we just, one of my favorite people on the planet, Dr. Robbie Clapper, who, shout out to you if you're listening. We just, I run this pre-med program at the hospital, so we just had him as our guest mentor talking to the students, and his stories are so captivating, and his journey is so captivating, and his passion is so remarkable, and his love of what he does and all the different things he does, and he's an orthopedic surgeon who takes care of a lot of athletes, so he definitely gets to see and deal a lot of stuff. And he has his own, or had his own radio talk show on Saturday mornings on ESPN, which is really cool.
That was a fun episode we did. People should look it up.
People should look it up. And he could talk about the champions, the Oklahoma City people who.
I'm sure he knows who they are.
Yeah, no, I'm sure he knows it, and I'm sure I embarrassingly had no idea who's on your T-shirt, but yeah,
it's SGA. People know, they know.
So what prompted me to want to talk about this is just Michael Madsen. Michael Madsen's death recently. Untimely, young guy, well-known actor from Quentin Tarantino. He was a Quentin Tarantino guy, right?
Yeah, Reservoir Dogs, Kill Bill, Volume 1. Just a lot of great movies. He did The Hateful Eight. I love Quentin Tarantino, so
yeah,
naturally I liked him.
Yeah, I'm a big Tarantino fan too, and the thing about him was, first of all, if you're a movie fan, which we are, and if you're especially a Quentin Tarantino fan, when I heard about any time I ever heard of him, it was just always one iconic scene in one iconic movie that made him who he is, I think, to some degree, right?
Yeah, you're talking about Reservoir Dogs, that one scene?
Talking about Reservoir Dogs, about the ear slicing scene when he's dancing to that song. Is it Stuck in the Middle with You or something? And yeah. And he's like dancing around, slow torturing this guy, and then he chops his ear off and talks into the chopped off ear. And it was just such a phenomenal, crazy scene. And I think, wasn't that Quentin Tarantino's first movie?
Was it it might be I think it might be the first movie he directed. He wrote a movie called True Romance, but he didn't direct it. And that's like one of Brad Pitt's first films.
Christian Slater.
Oh yeah, and then Christian Slater,
was in True Romance.
Yeah, that's right.
Yeah. So I think he died. Do we know why he died? Do we know?
So it's heart failure, but I don't know if they're like, it's heart disease and alcoholism were listed as contributing factors.
Right.
So I don't know who wrote the report, or if the report's official.
Yeah. So he was a guy who died, I guess, because of his alcoholism, and I'm sure he battled with it on and off, and I don't know. It just said when I heard about it, I was like, I have crossed paths with so many celebrities, for good or bad, who died of untimely deaths, and it just made me think of that. Like, I I still remember I didn't take care of her, so I think I could talk about it. I wound up taking care of someone who knew Anna Nicole Smith. She was like a famous Playboy model who then didn't she like marry, like she was like famous because she wound up marrying some old dude, for his
Right, yeah.
money, clearly.
Mhm.
But I was taking care of someone that she knew, and she came to, and the patient actually was a crazy story. It was much earlier on in my career. I was on call for the emergency room. I was the surgeon on call, and I remember I think I had family in town, and we were at the beach, and I get a call from the anesthesiologist saying, "Hey, we already brought the patient up to the OR," and I was at the beach. He's bleeding. He has a stomach bleed, a gastrointestinal bleed. He's bleeding out from an ulcer, and he's on the OR table. We're waiting for you. You better hurry up and get here. And we operated on this person, and did a big open operation, found the bleeder in the stomach, stopped the bleeding, and luckily, partly because the anesthesiologist brought the patient up right away and was working on the patient. And then after surgery is when I actually met the patient, because I operated on this patient emergently. The patient would have died. And I met the
Mhm.
patient, and the patient's like, "Oh, Anna's coming to visit." And I had no idea who he meant, what he meant. And then I remember meeting Anna a couple of times, and she was just this. Um, she seemed high, she just seemed on drugs or high or whatever. Super friendly, super nice, just seemed high on drugs. And she wasn't my patient. Um, and very soon after, not very soon after, but certainly within a year of that, I feel like Anna Nicole Smith was dead of an
Mhm.
overdose or something. And I still remember to this day, like I had some conversations with her, with this patient, and thinking, Anna Nicole Smith, she's a train wreck,
Mhm.
and like, I wish I had, like, it's one of those things where I wish I had known. I don't know, like, I feel like had I had some kind of connection, maybe I could have helped, who knows?
That's
I don't
one of
know.
the things too. Like, I'm like, what are you allowed to say? I guess just as a person, if you're not treating her,
She wasn't my patient.
you could just be like, "Hey, are you having trouble?" I don't know what the right
And
thing would be to
I know, and
do.
I didn't have enough of a connection, it was just brief meetings,
Hmm.
but right from that meeting, I was like, this girl's in trouble,
Hmm.
and I so that's what this Michael Madsen death made me think of, that and others.
Yeah, no, for sure. I remember she had a baby too. That like, I think just like a baby, and I think she had a
Yeah,
son that died. I don't know if he also died of an overdose, an older son.
yeah,
And then she had a baby that they had to figure out whose dad was. It was like a whole thing. I remember that.
yeah, pretty crazy. And then I remember, years ago, taking care of another patient, another big celebrity whose name I can't mention, who was in the emergency room because they had um, an implant implanted into their abdominal wall that was slowly delivering pain medicine. Like, it's a known thing, a way to, like, have, if you have chronic pain, you put this implantable thing in. And and I got called down because I was the surgeon on call, and the emergent and because it got infected, and the
Mm.
emergency room had already done the initial drainage and treatment of the infection and got the thing out, but they needed the patient to have some follow-up. So I went down there, made sure the wound was okay, scheduled a follow-up, yada yada. And then, sure enough, I get a phone call when the patient's supposed to follow up. No, we don't, it was probably the assistant saying, the celeb doesn't want to come. Can you go to their place, for the follow-up. And Hannah, who's my 21-year-old, had just been born. And I was like, no, I'm not going to their place. Wasn't that it wasn't like an easy.
Yeah.
Probably back then I wouldn't have wanted to make a house call anyway. I mean, in hindsight, it was such a decent celebrity. It might have been a fun thing to do, but I was like, no, and then, sure enough, years later, I don't remember how much more time, celebrity dead from, some drug thing. And like, had I gone and built a relationship, like, could I have made a difference? And the answer is probably not, but it's still, just, yeah.
Well, I would put, like, how do you get a pain patch like that? That's just.
Yeah, someone put it in, so some pain doctor, who's treating the patient's chronic pain.
Illegal. That's something.
No, it's a legal thing. Pain doctors do that. They implant these things. I think this patient, whether or not they had real chronic pain or addiction, I don't know, and I don't know who put it in, but they do have like these pain pumps that you could put in to patients for chronic pain and different kind of things like that. Actually, that was the first time I was pretty new to my career. It was 21 years ago, so it wasn't something I was that familiar with at the time. And I'm still not, I still, that kind of thing doesn't really cross my path. So to this day, I don't totally know how it fully worked and everything, but it was just, part of me wishes I'd gone to visit that celebrity just to kind of see,
Yeah, like you said, it's also better to go into the office or into the hospital in case you did have to do something. Like, you don't want to be responsible for just being at their house.
Yeah, no, that's not the reason. It was just I didn't want to schlep, and we had a newborn baby, and I'm like,
But Michael Madsen, did you know his sister was Virginia Madsen from Sideways? Did you know that?
I think now that you mention it, I did, but I probably didn't realize it at the time. That's his sister.
Yeah, and I was looking up, and they went to like a lot of premieres together, so I'm sure they were close.
They weren't spouses. They were sister and brother.
Yeah, sister and brother.
Wow, I don't know if I knew that, even though it seems obvious now.
Well, yeah, and I was reading people were giving him crap for like, why do you do so many like bad movies? And he was like, I guess he had been married maybe like a few times before. He's like, I got families to pay for, like, kids to pay for it. So
yeah,
some of his last films weren't his best.
No, that's for sure. Yeah, at that point, yeah, and I think he was battling alcoholism at that point, off and on.
Yeah, when it said he had been in and out of rehab. I think he was most recently in a Malibu rehab facility. So even if you had seen him and encouraged him to go to rehab, he'd already been doing it.
Yeah.
So
the interesting challenge, with those patients, if they have surgery and things like that, is their post-operative, dealing with pain is always a challenge. Taking care of people who are recovering addicts or current addicts, and taking care of their pain afterwards. In the obvious operative period, you have to give narcotic, to get them to sleep and all that. But once that surgery is over, you really want to avoid narcotics at all costs. And that's an interesting challenge and dilemma, taking care of these patients. These days, luckily, we've kind of gotten better at prescribing Advil, ibuprofen, and Tylenol. And while it's not a great thing, and with a lot of minimally invasive surgeries, we're often able to get someone through. But, even though I'm not prescribing narcotics for the patient, it's hard to know for sure if they're going off and finding their own narcotics and things like that. The Ozempics and the Mounjaros today, the interesting thing about those medicines, in addition to the weight loss, there's a lot of studies now and anecdotal evidence that drinkers and smokers report that when they're on those medicines, they lose not everybody, but a lot of patients are like, yeah, I don't feel like drinking, or I don't feel like smoking. So actually, that's one of the things. The patient, interestingly, is quite overweight. So one of the things we're saying to the patient is, before surgery, I'm like, as soon as surgery's done, I want you to go on this medicine for 2 reasons. A, it'll protect your heart. 3 reasons. It'll protect your heart attack. You'll lose weight. and maybe we could get you to stop drinking too, which is so interesting.
Yeah, no, I've heard that about Ozempic.
Yeah.
So that's a added bonus.
Yeah. I had another patient. I'm just thinking of celebrities that I took care of over the years who have died. Luckily, none of them at my hands. I took care of this one celebrity's child who was an adult already, but a child. And because of that, I kind of got close to the celebrity, and and um, and the celebrity was having some upcoming surgery and things, and I wasn't the doctor for the celebrity, but we had gotten close, and the celebrity was such a lovely person, and charming, sweet, down to earth, and the the celebrity was having this upcoming big surgery, and I remember talking to the celebrity a lot about it, and telling them that, just kind of comforting them. And then sure enough, the craziest thing is, I think the patient wound up dying either on the table during that surgery or very shortly thereafter, which was just great, because I was kind of like a support person for that person before surgery, and the surgeon that the person had it with was a really good surgeon, so it was like a really weird thing to happen. But like, so bizarre.
I want to ask more questions, but I won't.
I know. No, it was really, it was a tragedy. It was a tragedy. Really, really bizarre stuff. And then I have, some other patients who I know have gone through up and down, drug addiction and things like that. Andy Lassner, who's not a patient, but who I grew up with, who's a friend, who was the Ellen DeGeneres producer and now is a Jennifer Hudson producer, who's never been a patient, who's just a friend who we could talk about. He's been a podcast guest. He's, battled addiction too, and his stories that he shared with us on the previous podcast episode are amazing. And luckily, he's doing great, and I hope he continues to do great. And I make sure to, try to check in with people from time to time, whether they're my patients or not, just to, and he's really good at himself kind of letting other, he's got that social media presence of letting people know that it's okay to not be okay. That's really important to know.
No, that is important. And I have a question, just like, as a doctor, like, do you, like, if you do notice a patient needs rehab, like, do you have like one that you recommend, or how do you even approach it?
I've never told a patient to go to rehab. Maybe because as a surgeon, I don't really deal with that, but I haven't had patients who see me for surgery and they're like, yeah, I take Vicodin every day, or I take every day. And I realize that they're addicted to the narcotic, that it's more than just for pain. And interestingly, those patients I've sent to, we've talked about her, and she's been a guest on our podcast, Dr. Sherry Yafai, who's an emergency room physician, but she specializes in cannabis medicine. So I've had her help me with patients. And one of the things she does, which is fantastic, is she'll get patients off of their narcotics using cannabis, and then she'll often get them off the cannabis. Some patients stay on a little bit of cannabis, which is just fantastic work that she does. And that's really been a great thing to be able to send patients to her. Yeah. And so, and we're going to get her, I think we'll get her back on the podcast too, is one of my hopes. We talked about Matthew Perry. Did we talk about Matthew Perry?
We did on our last podcast. It's up now. Yeah.
Yeah. Which is also, we talked about the doctor being blamed. And I think, how much that the doctor should be blamed that he didn't try to help Matthew Perry get off of, the addiction, I think. But in terms of, I don't know, it's just a whole other interesting thing.
No, I mean, yeah, I don't know anything about like people actually having like addictive personalities versus people not having addictive personalities. I don't know. Matthew Perry's been like that since he was like a teenager.
Yeah. It'll be interesting to see if really right now, those getting back to the medicines, the Ozempic, the GLP-1s, the Mounjaros,
Mhm.
they're really only being prescribed for weight loss and sugar management, heart disease management, but I wonder if at some point people will actually prescribe them to see if they'll help with addiction. That's been shown to be an added plus and an added benefit, but I wonder if at some point people might switch to doing that, and I don't know. The other thing that I don't know a lot about, and ketamine, which
Yeah.
um, is being used to treat suicidal ideation, suicide, people who are suicidal, and it's used as a one-time ketamine infusion, in a monitored setting, and supposedly that works amazingly, at least for up to maybe 2 weeks, to halt a lot of people with suicidal ideation, with wanting to, and I wonder if it might translate to. I guess that's what they were. Wasn't that what Matthew Perry was getting too?
He died of, yeah, I guess they said a
Ketamine, right?
ketamine overdose. But yeah,
Yeah,
I mean, if he had done a lot of damage to his body from all
right.
the abuse, the drug abuse. But yeah, it was a ketamine overdose because it made him just basically pass out,
Sedated. Yeah,
and then he was in a hot tub.
right. But I wonder, and I don't know, and this is beyond my knowledge of things. I wonder if ketamine is gonna, if it's already been used, if it's looking at being used to try to treat addiction. And my guess is it is. I'm totally ignorant. I didn't look it up. I didn't even know I'd be mentioning that. Um, but I
Well,
wonder.
suicide. I mean, it's not really anything we've talked about, but it's such a big problem, especially in America. So I mean, I hope that's true. Like, if they can stop people from thinking that way for at least 2 weeks, maybe they can
Right, and the
reverse
thinking
it.
is then they start their antidepressants. The antidepressants will kick in by then. That's kind of the thinking. It's kind
It's
of
interesting.
it really is. Yeah, it really is interesting. And I wonder if it's the same kind of thinking with suicide and depression. Is there something similar pathway wise in terms of addiction? And I'm not smart enough to know that answer.
I don't know. We don't know any addiction specialists, do we? No.
We maybe do. I have a psychiatry friend. Maybe we'll get him on. I got to ask him, but that could be really an interesting
Yeah,
discussion
I'm
topic.
really curious about the genetics of it too. Like,
Yeah,
people, like Ben Affleck said, his dad was an alcoholic and he was an alcoholic. Like, interested in like that aspect of it.
yeah. There's definitely that stuff. Unfortunately, is definitely familial, and how much is environmental versus genetic. It's hard to say for sure. I think it's definitely a combination.
But I feel like your parents, not big drinkers, not big anything, nothing in your family.
Yeah, luckily, yeah. The crazy thing about my father was he claimed that he never really had a drink of alcohol until his father died. And his father died when I was 13, so he was still youngish. But my dad was 25, 30, late 30s when I was 13. So he didn't really start drinking at all, my dad, until his father died, which is really interesting. And he was never really a drinker, but he never really drank until then,
Yeah.
um, which is bizarre. And my mom, I don't even remember. Like, we didn't like alcohol was not a part of my growing up at all. Family, nothing. Like,
Hmm.
we'd have on Friday nights, we'd have part of the Friday night Shabbat Friday night meal. You make the blessing over the wine and the blessing over the bread, and then you eat your meal. So we would have Shabbat wine, which was like really weak, not strong wine. It was more like
Hmm.
grape juicy with a little bit of alcohol, and that was it. And my dad actually liked to, and everybody would just take a sip from his cup, and
Hmm.
then he would take the rest of it and mix it with club soda, seltzer, and kind of drink it as a soda over the rest of the night. This drop of a glass, and
Yeah.
that was his thing. And that was all I never saw him drink until after, his father died. And then and then barely, like still after that, it wasn't until I was like an adult already, legal, that, then sometimes we'd go out and, he'd get a bottle of wine or something like that for the family, and that would be it. What about your
Yeah.
family?
I mean, we're Catholic Italian, so yeah, we probably drive more.
Yeah.
Not my mom. No.
Yeah.
But yeah, I mean, drink wine like as part of communion growing up too. I don't know. I'm sure it was the weakest, cheapest wine.
Yeah. Probably same kind of wine that we had.
Hmm. But yeah, I think Italians are probably bigger drinkers.
Yeah, maybe. What always blows my mind is, one of the things I do when I'm talking to a patient is less these days, but I usually take a social history. I'll ask patients, do they
Hmm.
smoke? Do they drink? Do they use marijuana, other drugs? I think it's a little bit less these days, but it always, everybody's like, yeah, I have a glass of wine or two a night, like that's the norm, like that's
Yeah.
totally okay. And I have a lot of friends who are like, every night they'll have a drink or I know a lot of people like, and the interesting thing is the world and the medical literature is like a glass of wine a night is red wine is good for you,
Yeah.
which is totally sponsored by, the wine, the alcohol industry. And certainly, you could write a paper that it's good for you. Why it's easy to make data do whatever you want it to do. So yeah.
Yeah.
And the funny thing is you're an alcoholic if you're having a couple of glasses of wine a night. That's an
Yeah.
alcoholic. But yet it's normal.
Like I've had those questionnaires at doctors' offices, and I kind of always just fib. But now I really
Everybody
don't
lies.
drink anymore, so now I don't have to fib.
Yeah. The other thing that I've heard more and more, and I don't know if you have too, from people I know who have had these experiences where they'll go to a bar and they'll be talking to someone, whether it's flirting or, picking up someone, and the next thing they know, they're waking up in a weird place and they've been like roofied
Yeah.
and like all their stuff's been stolen. Like I've had a lot of people, not a lot. I've had enough people within the last few years that I've heard it happen to. And that's
Mhm.
crazy scary.
Yeah, I heard it. It happened to someone I knew not that long ago, but they were with their friends, so their friends saw them like fall and they took them. But yeah, they literally were at a bar. Somebody roofied them right there. Luckily, it
Yeah.
was with other people he knew.
Yeah. And it happens not just to girls, young girls,
Yeah,
it
no, it
happens to
happened
like
to this
older
guy.
men.
Yeah.
And the interesting thing I heard about it is the older men are like deliberate targets because it's like, especially married older men, because they don't want to admit that they were talking to a
Oh,
woman,
wow.
and they're kind of like stuck and they don't, and they wind up. But what's scary as a parent is like with young girls, that scares the crap out of me when I hear that,
Oh, I can't imagine how many times you've told Hannah and your all your
Yeah.
daughters to
Yeah.
watch out.
Especially if they're traveling or going somewhere, it's
Mhm.
like, don't take a drink from anybody. And
Right.
even your own drink, don't put it down.
Don't need it. Yeah, exactly.
Yeah. It's crazy.
Right. Well, do you have any other? It doesn't have to be celebrity or like uh, alcohol, drug related deaths. Anything else you want to like share with our audience? Maybe they should know, be aware
Uh,
of.
I recently had another patient who I've been taking care of now for a little while. Great patient, young patient who um, has been in and out of rehab, trying to get themselves okay, and has a good, at least seems to have a good support family. But recently relapsed and is now getting themselves back okay. And this is a patient who I've given my phone number to, and I'm like, and they recently came in now that they're okay for some other issue, and I'm like, text me, call me, but
Mhm.
I guess, and it's heartbreaking, this person's been through so much and had a really tough time of stuff, and seems like they're getting their lives back, and it's it's one of the reasons why we become doctors and go into healthcare to like try to help these people. And even though it's so not what I do, I'm a surgeon. I just want to cut you. But when I see this kind of thing, it's heartbreaking. And um, and I just saw them, and I'm like, listen, you got to text me or call me if stuff's going on,
Yeah,
And
that's good. Yeah, so many people struggle. Yeah, it's hard too when you see people trying so hard to get it together and then they slip up. I've seen
yeah,
that before. It's devastating.
I know, because it's easy. It's easy to do. Something's not going great, and it's super easy. Not necessarily a happy episode, but
Well, it's interesting though. I mean, obviously, I don't know any celebrities, but yeah, I've known people with drug addictions. It's hard to watch.
yeah, it definitely is. Definitely is. It's definitely is. What else, Lauren Taylor? Any positive stuff to end this on?
Well, I'm waiting to watch The Bear until
Oh, when does the new season start?
it's out already. So I'm waiting
Oh,
on that.
wow, I didn't know. And
Yeah,
he's an addict too, right? In The Bear?
his brother was. Is he an addict? He's like in grief counseling. I don't know if he
Oh,
was
is
in
that
that.
just grief counseling? Right, he's not an addict,
I
but
don't
he's
see.
chronically smoking and chewing well, he's a
Oh, he's
smoker,
definitely a smoker. Yeah.
and then he's trying to chew the nicotine gum to get
I
off the
don't think he
smoking.
drinks or anything. Or
Right.
yeah,
He's not smoking to not drink?
I think so.
I don't remember. Yeah. So he was just in grief
Yeah,
QAnon, right?
that's like a QAnon. Oh, is it? Oh, maybe.
Isn't QAnon for wait, what's the Al-Anon? What's the thing for family members
QAnon
of
was like the conspiracy.
Oh, is it?
No, QAnon.
What is it called?
Al-Anon? Is it something?
Is it Al-Anon?
QAnon is a decentralized far-right political movement.
Okay, that's not what I meant. That's not what
That's
I
why I
meant.
paused. I was like, wait, I think it is. It's something Al-Anon or something.
Huh. Yeah, it's Al-Anon. Al-Anon. Yeah,
Yes,
that's what it is.
Al-Anon can be a helpful resource for individuals grieving the
Yeah.
effects of alcoholism, whether the alcoholic is still living or deceased.
Yeah. It just made me think of another movie. Fight Club.
I like that.
Do you know why it made me think of Fight Club? Wasn't one of the things he was doing was going to these support grief meetings? And that's where he met,
Because
what's her name?
they just couldn't sleep, so they were just going to all these meetings.
Was that the thing? He couldn't sleep, so he was going to the meetings?
Yeah, they just like wanted to like meet people or do something. Helena Bonham Carter. She was like, I can't go to this one. I think it was like almost for prostate cancer or something, and she was like, my smoking doesn't go over well at all.
And they would go to these support group meetings.
Yeah, I think it's just like, I think they both just couldn't sleep.
Yeah, isn't that where they met Meatloaf? Where he met Meatloaf?
I'd agree, or at one of those things. You're right.
Yeah, I think that was the prostate cancer one, right? Because he was getting treated for prostate cancer.
Yeah, or he might have had breast cancer or something. But you're right.
He was getting treated for prostate cancer, and one of the treatments for prostate cancer is to get rid of your testosterone. And because of that, and it's anti-testosterone, because of that, he wound up developing breast development called gynecomastia, which we've talked about before.
I knew there was something with breast. Okay, yeah.
Yeah, exactly.
Good memory. Yes, I saw that movie so many times back in the day, but I haven't seen it in a while.
Not in a long time. No, me neither. So The Bear's already out. What about movies? Is there anything you're looking forward to?
I saw F1.
And? I didn't see it yet. And?
I don't love it.
Okay.
It wasn't my favorite performance of his. That's what I'll say.
What's your favorite Brad Pitt performance?
Probably Inglourious Bastards. Quentin Tarantino.
Okay.
That's one of my favorites.
Okay.
I mean, I also like Fight Club.
Yeah.
What about you? What's your favorite Brad Pitt?
I really liked Once Upon a Time in Hollywood with Brad Pitt.
Yeah.
I liked him a lot in that. Actually, I liked him and Leonardo in that. I liked them both in that movie. But I liked a young Brad Pitt, in Meet Joe Black.
Yes, I was actually going to say that too. I really like Meet Joe Black.
He was just so beautiful in that movie,
He was. I think it's an underappreciated film.
and it's
Yeah.
kind of like drawn out a little bit. But what's her name is gorgeous. The two of them were gorgeous. What's the woman's name? I'm blanking on her name. But the two of them were just so
Yeah.
beautiful to watch in that movie.
And Anthony Hopkins is in it.
Yeah,
It's
yeah,
great.
yeah.
Mm-hmm.
And then I kind of am looking forward to seeing Superman.
All right, that's going to be all you. You're going to have to tell me what you think.
Yeah, I'm kind of looking, and the Super Dog, that'll be fun. Crypto also.
Well, I mean, yeah, you got to get excited. Well, that's why I went to go see F1 because I was like, all right, it's just like big movies are out. That's what's out. So
Yeah,
try to get on board.
yeah. I used to. I rarely go to the movies anymore. It's such a shame.
But you love going to movies. So do I.
I love going to the movies.
You'll see Superman.
Yeah, we got to go see Superman. Actually, the movie that I think we're going to go see with the family is, even though I don't know if my kids listen to these episodes, guys, I know you're all excited for us together to go see How to Train Your Dragon. And I want you to know, I loved the animated How to Train Your Dragon. I loved it. I liked it better than Avatar, believe it or not. Like, I thought that was better than Avatar. The original How to Train Your Dragon. I thought it was magical and a great story. But it's an exact same movie. Like I'm like, I rarely see movies. I don't want to have to see the same movie again. So that's the only, I don't have the heart to tell my kids that. Like, it'd be one thing if it were The Godfather. Yeah, I'd go see it again. And I loved it. I loved How to Train Your Dragon. But I'm like, there's so many movies out there. Do I really need to go see the exact same movie again? Just shot differently?
The trailer makes me think like this. It doesn't really look like a real dragon. Like, what's the point of this being like?
Exactly. It doesn't look It doesn't look like Game of Thrones.
So, but I was wrong because I guess people are loving it, and
because it's a great movie. But I think, yeah. I mean, How to Train Your Dragon is a great movie, but it's the same voices, it's the same motion, it's the same. Like, I saw trailers. It's the exact same movie.
Mm-hmm. So, and the costumes look terrible. I was just like, what is this? It doesn't look good.
Yeah, and it doesn't look real.
Mm-mm.
No, it looks like what was that horrible Tom Hanks movie? Do you remember? Do you know the one I'm talking about? Something Express, Polar Express. Did you ever see that movie?
Oh yeah, but that was animated, right?
It was animated Tom Hanks, but it was awful, right? And the animation was bizarre and weird. It almost seems like that, and I don't know.
Well, you're gonna end up seeing it now.
Of course, my kids want to go see it. Like, they're planning, like, that's what they wanted us to do on Father's Day. Aww. And luckily, for whatever reason, because they thought because I loved the movie. They knew I loved. So like, we got to all go see it. And I didn't have the heart to say, I don't really want to see it. So it's still on the list because we never did it. So everybody's still excited if and when we're going to all be together, we all have to go see it. So.
Or you could just say, I really want to go see Superman.
Yeah, I think so. Plus, hopefully it won't be in theaters anymore.
Soon.
Yeah, exactly.
I think so.
All right, Lauren Taylor.
That's all I got.
That's what I got too. It's a sad episode, but you gotta talk about it. You got to deal with it, and people out there listening, don't be afraid to. It's a weird thing, if you think someone is struggling, my word of advice is, it's hard conversations, but if it's someone you care about and love, it's worth screwing up for a minute, and saying, there's something going on, I'm here for you. It's definitely worth it. You may piss them off, but, and hopefully you're wrong. Hopefully they don't have an issue and a problem, but let that be the worst thing. So don't be afraid to have those conversations. Have them fast, have them early, have them soon. And those are kind of my thoughts.
Yeah, no, I agree.
Thanks, Lauren Taylor.
There's only so much you can do, but
there's only so much you can do.
That.
Yeah. So thanks for joining us, everybody, on Gross Anatomy. We love your feedback. We love your comments. Check us out at Gross Anatomy podcast on Instagram. Check us out on TikTok. On where else are we, Lauren?
Well, we're on Facebook. People still do Facebook.
People still do Facebook. So check us out. We'd love to hear from you. Thanks, everybody.
Thanks.
Bye. That's how you usually go. Bye.
Bye.
There you go. That's it.